It doesn't work well, I should say.
All right, we are filming now, Melanie. We're going to be taking care of 2 class 5 type restorations on teeth numbers 4 and 5, and I'm just going to narrate as we're going along here, Melanie. Got 4 and 5, got existing crowns on them, and due to abfraction, some historical grinding and wear, we've got some pretty severe abfraction on these, and they are needing some repair. So I'm going to show you my technique for repairing these. Step 1 is anesthetic. Step 2, we're going to place in some cord here to push the gum just back off of that area and make them, you should get a little access. Maybe you turn away from me just a little bit there, Melanie. That's great. A little bit more. That's perfect. Thank you. Okay, so we're going to tuck in our number 1 cord from Ultradent. This is soaked in Hemodent to help to slow any kind of irritation of the heme, trying to get in on the action. So do a little retraction as well so we can finish those margins as effectively as possible.
Doing okay, Melanie?
Mm-hmm.
Good. Lots of pushing and pressure.
And just rolling in these guys here. Tucked all the way around past the finish line on both the facial and lingual. So there's a few different ways that we can do this. We can freestyle it as far as when we're filling it in, or we can use a blue mylar strip. There's not really decay here, but I am going to create a little bit of micromechanical retention with the coarse diamond. Freshen up the dentin just a little bit. So I'm going to use a blue strip for our front one here. I'm going to grab me one more.
Someone's threw in a stash in here. I'll leave it out in here.
Nice. Okay. What's going on with the loops? I keep getting double vision. That's kind of doing weird stuff though. Okay. So it's nice to keep it long until you get it in, because if you try to make it short, you can't. There's less to grab onto to kind of floss it into position like I'm doing. All right. And close down about halfway there, Melody. Good. Okay. Alright, we're going to tuck this guy down. And tuck this one. Pull it and tuck it into against that distal side. Kind of where that gingiva wants to hang out there. Right, and that gingival sulcus on that distal facial side there. Okay. So as you might be able to see, it doesn't really want to tuck in there yet. So I'm going to reverse it back out. Then I'm going to kind of accentuate that angle there. So I'm sliding it down, tightening it back up. Okay. Now we can see that it sits on the mesial side of the papilla, which is what we want, and that's going to make it much more friendly. And scissors. Okay. First one looking good there. Okay. Because it's going to be kind of tight to fit the second one in, I don't expect I'll be able to, but I can try to get a second one in. Yep. Get a second one in there. Yeah, that's not going to want to slide in to get two of those guys in there. Be a bit too much of an ass, so we'll just freestyle the second one. Okay, I'm gonna have you turn away from me again there, Melanie. Good. Close down a little more and turn away again. Good. Okay. So you can see this one's tucked real nice around that tooth. Good. This one looks just fine. Shouldn't have any major issues. Freestyling that. I'm gonna tuck this cord a little bit better there. Gonna tuck that edge. Okay. Then we're gonna proceed with our normal Fuji 2. These could be treatment planned as a straight class 5 facial, or depending on how much it extends around the facial and lingual line angles, it's also reasonable to treatment plan them as a MFD class 5. Okay, we're putting in our polyacrylic acid Ketac conditioner. This sets up for about 20 seconds or so. A little longer is not a big deal. Just some happy little conditioner. You can just put it wherever you want. There's no wrong way to scrub it in. Just a happy little scrub. There you go. Channeling my inner Dr. Ross. Okay. All right. Suction.
Make them happy little teeth.
Happy little teeth. All right. Doing great. Close it a little bit more. Then good. Okay, and this is our Micro Prime G, which disinfects, desensitizes, and helps with the strength of the bond. Alright.
Just getting a team on time, ETA?
He'll be over in room 4 in
About 15
15
minutes.
minutes now.
Thanks, Marlene.
Thanks for checking in. Good to mix.
Okay, go ahead and mix Fuji 2. Yep. and just a gentle blow off there. It doesn't need to be desiccated. Orange ligate here. Okay, overfill that just a little bit here.
Will not be missed.
Alright, so we're gonna do a little bit of basic shaping. This one just mostly just kind of scraping away from the tooth. Scrape it off the rest of my glove, and then this guy. Do kind of initial shaping in here. Minimize how much work we've got to do in that mesial embrasure area. I'm gonna finish. Just kind of scrape that guy around there. Okay. All right. And to cure this, I'm gonna grab my cotton forceps here. Do a little shaping on that, and then pinch just a bit. Okay. Go ahead and cure. Right there. Sets that up. Little power cure. Nice. I'm going to cure again. And again. And as you might be able to tell, once we take this guy off, we get a nice clean transition in proximally with this guy. This one I got to clean up just a little bit more. Start with the skinny or fat red diamond. Either one will do. Okay, that's about 90% shaped. Now I'm going to remove our retraction cord here.
Very snug.
Okay. Now we take our skinny flame, burr, eyes, smooth right up to that gingival margin, nice and smooth, light pressure. Okay. Excess kind of flaked off. And nice finish. Check there. Smooth transition in and out, up and down. Same thing there. Smooth transition to the genital margin. Now to finish it off, we're going to use a skinny sand strip. And cruise around those line angles. First with a little bit of the coarse paper there. And then switch to the fine. Close down a little bit there. Good. Coming up here. Same situation, a little bit on the coarse. Okay, and a little bit on the smooth. Flip it around. Number 4 mesial. A little bit on the coarse here. Up and down. Not through the contact. Okay. And there. Okay. Check for any catches by kind of scissoring it a little or shimmying it, shoe shine. We don't want any little threads catching there at all. And we're going to do a final visual check. Still looks good. Still looks good. We'll polish that just a little bit more there. Okay, sand strip. Okay, last little bit here. Okay, final rinse here. And turn away from me just a little bit. Good. Okay, that'll do. All nice and finished. I'm going to polish this down just against that porcelain there. Just to polish up that porcelain just a little bit. Little bit of material that's onto that porcelain. I'll remove the rest of that. Oh, sorry. A lip pincher there.
Very focused.
Just kind of slipping around. Okay, and final polish here. There you go. Okay. looking good. Verify lamination. Okay, nice and smooth. That'll do it. There we go.